Palliative care takes a holistic approach to patient illness, providing support to patients and their families with not only physical symptoms like pain, but also considering emotional, social, and spiritual needs. Palliative care providers focus on pain and symptom management, emotional support, care coordination, decision making support, and may be involved in end of life care. Palliative care services can be provided in both an inpatient and outpatient setting. During our project, we shadowed palliative care providers in both inpatient and outpatient settings. We identified over 100 needs, categorized them, ranked them based on patient priority, provider priority, current field satisfaction, and solution feasibility. The top ranked clusters were further assessed and the top 10 needs were presented in an importance versus satisfaction survey. We conducted this survey with a diverse group of palliative care providers, including those in patient care as well as those in administrative and leadership roles. This comprehensive process led us to identify 3 top needs in the palliative care setting.
Palliative care is frequently confused with hospice, but they have distinct roles. Palliative care addresses symptom management, where providers act as somewhat band-aid doctors who improve symptoms without treating the root cause. The main provider, for instance, an oncologist, handles disease treatment, while palliative care addresses pain and enhances quality of life. Hospice also focuses on symptom management but excludes disease management. Patients opting for hospice must decline curative intent treatments like chemotherapy. If a patient's prognosis exceeds 6 months, palliative care manages symptoms while the main provider focuses on disease treatment. For prognoses less than 6 months, hospice focuses on symptom relief without concurrent disease treatment. You're not the only ones who may find the distinction between palliative care and hospice confusing, and you may not have known what palliative care was until this video. Unfortunately, many providers are also unaware of what exactly palliative care is and may not know the distinction between palliative care and hospice. This brings us to our first need, which is that non-palliative care providers need a way to identify the appropriate time to refer patients to palliative care and hospice. Patient providers, such as oncologists, pulmonologists, and cardiologists, currently face challenges in identifying patients to refer to palliative care and hospice, or may confuse the two. Creating a way that they can effectively and efficiently identify the correct patient and correct time to refer patients to palliative care and hospice will improve patient outcomes, including their quality of life and even life expectancy, as seen by various research. Correctly referring patients to palliative care has also been shown to save hospitals money, as can be seen on the following graph.
Moving on to our second need, patients with chronic illness often see multiple providers and regularly undergo changes in their medications. Taking so many medications prescribed by different providers and having a constantly changing schedule can cause confusion for patients. Need 2 is that patients need a simple and reliable way to be able to track and plan medications due to the large quantity of prescriptions and constant changes in medications, dosages, and formulas.
Palliative care providers require access to detailed patient data, especially patient symptoms. Effective pain management is a critical component of palliative care, often involving medication adjustments. Currently, after a visit, nurses follow up with patients via phone call. However, there's a gap in information and time between the visit and the call, leading to potential inaccuracies in symptom reporting. Based on our findings, there's a need for granular data on patient symptoms and well-being, facilitating better understanding and more accurate recommendations during patient visits. Having the opportunity to learn about palliative care emphasizes the importance of this field for patient well-being and quality of life. We hope that our needs will lead to a solution which can help alleviate challenges that palliative care providers currently face.